Let's continue our discussion on setting up a concussion clinic by talking about your concussion care workflow. After deciding your concussion care team and deciding on your business goals, an important next step is deciding which parts of the concussion care process you want to handle. Some steps might include concussion education. Concussion care providers provide valuable education to parents, patients, school staff, and the general public on concussion symptoms, signs, and how to get back to activity. It can set you up as a go-to and a trusted resource for concussion education and concussion care. Next is baseline concussion testing. Baseline testing is another great way to get word about your concussion care services out to your community. Baseline testing ensures that in the event of a head injury, you have a clinical report to show you data on a patient's normal neurocognitive functioning, and you can go from there. Third is a point of injury evaluation. Removal from activity decisions are a crucial part of concussion care. With the right tools, training, and team, acute injury management can be a critical part of your concussion care process. Next is complicated concussion management. You need to have a referral network for complicated cases. Now, only 20% of concussion cases have been seen to last longer than 3 weeks, but you need to have a system in place so that you're ready to manage those difficult cases when you see them. And lastly, you can be involved in return to activity clearance decisions. Now, you need to be familiar with the laws in your area and regulations surrounding return to activity, but if you meet these criteria, you can become the go-to provider for making those return to activity clearance decisions, whether it be sports or returning to work or school in your community. And these are just some of the areas in which you can be involved when you're providing concussion care. Check out our Concussion Care 101 guide on concussioncareproviders.com for even more tips on creating your own concussion clinic.